Director of Research and Content Development at Huddle Up Moms. And so we thank you so much for joining Huddle Up Moms today for the 2020 Roanoke Pregnancy and Postpartum Resource Summit. It's our first, but it's going to be an annual event. So this is a really exciting opportunity for kind of everybody getting these resources together in one place for your pregnancy and postpartum needs. And so today we have Holly Borkert and Rebecca White with us to talk about midwives, all things midwives. So we're excited to learn about that from you guys, the experts. And I just first wanted to start off by getting a little introduction from both Holly and Rebecca, and we may have one additional person joining us. So Holly, do you want to go first and introduce yourself?
I would love to go first. I am Holly Borkert. I'm a midwife practicing in the New River Valley area of Virginia. I've been here for about 3 years, going on my 3rd year in practice. I'm in a full scope clinic, so I do well woman care, prenatal care, deliver babies, postpartum care, do it all. Love what I do. I have 2 children myself. In my small amount of free time, we just bought a house, so we're working on kind of getting that together. That's why it looks like I'm in a undecorated box. So I was trying to find at least one room in my new home that we had hung something on the wall, but I couldn't find anything. So I'm in a box today. That's just how I'm rolling at the moment. So that's me.
Awesome, great. And Rebecca?
Sure. Hi, I'm Rebecca White. I'm also a certified nurse midwife, practicing in the New River Valley for about 6 years, and then just expanded watersheds up to the Roanoke River Valley, up where I'm part of a group of 3 midwives now up at Lewis Gale Physicians Midwifery in Salem, Virginia, with some offices back, also satellite offices back in the New River area. And I've been practicing as a midwife for about 11 years now, and have had a wide continuum of experiences. Feel very lucky to be able to have had a wide continuum of experiences in the birth world in terms of home birth center, freestanding birth center, and hospital, as well as, like Holly was mentioning too, we do full scope, so also working in GYN settings. Again, also as a sister midwife, it's a work that you love as you are called to do it on many different ways and many different times of the day and night. And then for myself in my free time, my husband and I have a tandem canoe that we go paddling around in, and I have a small little garden that I tend through the weeds to try and get something nourishing for us. So. And hiking with our little pup. So that's sort of me in a nutshell.
Awesome, wonderful. So I was just talking to a bunch of doulas, which is really exciting, and learning about all the things that they offer. So I want to hear kind of the same thing from you. I know that, I think a woman can choose either to get an OB/GYN or get a midwife, right? Can you describe what a midwife is, kind of give a definition, maybe give a little history? I find the history of midwifery really interesting. And so give a little bit of information about what a midwife is in general.
Sure. So midwife, and Holly, feel free to jump in anytime. So midwife, in terms of and the origin of the word is with woman. So it is sort of a grassroots, I think of it as a real grassroots profession. And so it started out, I think, in that sense of a community-based wise woman, or sort of experience where then it was someone that would be able to be present with women during this time of childbirth. And then in terms of the history in the United States, there's a lot of different pockets of midwifery, granny midwives, traditional birth attendants, that then sort of grew into the part of it is the American College of Nurse Midwifery. And then also there's the Midwives Alliance in North America. So a lot of different wonderful organizations that support midwives in the hospital, birth centers, and in the community. And so that's sort of our history. We've always been sort of a grassroots organization, I would say. And Holly, if you want to talk a little bit more about the other sort of question about what we do, I'm happy to pass it to you for that.
So yeah, so what we do, so you did really well with our history. So kind of what we do now, kind of more myself and Becca, what we do specifically, like we said, we're full scope. So we can do your prenatal care, we can deliver your baby, we can take care of your, do your pap smear, do your well woman care, take care of your birth control needs. Becca and I work at very similar practices. So if I misspeak and if I do something that you don't do, or if you do something that I don't do, feel free to jump in. And I think that, like you were saying, women have choice. So you choose the provider that you're comfortable with, the provider that you feel most comfortable with. Because when you're having your baby, you're going to be with a provider that's going to be with you for a long period of time, for almost a year of your life. So you choose a provider and a provider philosophy that you're comfortable spending a long time of your life with. That's why it's important to know what we do and how we approach your care.
Yes, absolutely. I agree with that, especially because just adding to that, Holly, that sense of the philosophy of being really from a sense of wellness. We start from that sense of wellness and health, and I feel like oftentimes we're guardians of the natural process. So, protecting that space throughout the lifespan, as Holly was mentioning, so in terms of what to promote wellness and to take what's there and move it forward so that women are thriving in all forms of their health and through all aspects of their life. And so I think that that's also a big part of our philosophy as midwives. Again, sort of that sense of holistic care, and then also transformational care in terms of really trying to pin down what the goals are for each unique person, and then helping them attain them and work towards them.
And that's why I got into midwifery. My background is in neonatal intensive care. And that was it got so frustrating and so rewarding, but so frustrating. And I got burned out so much. I was in it for 12 years. And I got so burnt out. And I realized that women's health is just one of the few areas in healthcare where you're promoting a normal process and you're not fighting against sick. It's one of the few just pure areas in healthcare where you're not fighting, you're promoting wellness. And it's so much fun and it's so rewarding.
Yeah, I love that idea of wellness and holistic care, and that, you can really see the pregnancy as a well experience, right? Not like a sick experience to be tended to in some way. So that brings up my question of, if a woman, what does a midwife offer that the traditional OBGYN care doesn't? Or are they complementary? Would you see both together? How does that work?
I think it can work a lot of ways, and a lot of it depends on the specific group that you're seeing. So a couple ways that it can work is, and then a lot of it depends on how the risk level of the individual, the patient. So some women come in and they see a midwife completely for their entire care. And that would be somebody that's completely, low risk, has no other risk factors, has a normal vaginal delivery. They could see a midwife completely for their entire care. Some practices, like the practice that I'm in, we work very collaboratively with our physician colleagues. And sometimes they see a midwife, sometimes they see a physician. That's the way our group is structured. We share all of our patients and we work very, very well together. We have very good team dynamic. And I love that about our group. So sometimes they see a midwife, sometimes they see a physician, and that's just how it works out. It's not necessarily risk-based, but we just work really well together like that. And then, sometimes you see one or the other. And that would be another thing that women would want to know going into their care, kind of who's going to be taking care of them. Rebecca, do you
Yes.
want to elaborate on that more?
Yeah, no, and it is so true. There's such a just a continuum too of where midwives work, and in terms of that, I think it's very much a symbiosis, like Holly was saying. So either that collaborative practice where the midwives are working in a really close proximity to physicians, and you share a panel of patients, and then everybody brings their talents to the table in terms of, again, looking at that, our philosophy being more that base of wellness, and then the physicians, that they also have some of that training, but also their training is a little bit more towards pathology, complication, things like that, of which we also have training in. So there's a lot of overlap there, just in terms of where the majority of our expertise is. And it's like a little Venn diagram where in the middle, there's this lovely little spot of symbiosis. And you're right, in terms of the wide variety. So oftentimes I say that in the hospital settings, you can, so you can have sort of this sense of, even though with that high risk patient, you can still be able to tuck in a little bit of midwifery there in terms of just that talent of, let's preserve what's normal. What is normal is still normal. So that's oftentimes, interestingly enough, I've even had friends who work in very high risk, like at the Children's Hospital in Philadelphia, and special deliveries, where it's a very complicated fetal anomalies and people go there from all over, but there's still midwives in that practice, because in that sense that they want to be able to have that connection to the normal, connection to the education, connection to that interconnectedness with women, with their babies and with their families. And midwives, oftentimes that's much more of their lens, just because the physicians, they have a lens that's sharp and wonderful of their own. But oftentimes midwives can bring just a little bit of a different perspective for that, again, going back to that sense of wellness.
To expand on that a little bit, here within Carillion, the midwives are branching out into the OBOT, into the addiction medicine program, which I think is awesome and is so exciting to be able to bring midwifery care to that population. And I'm ecstatic. I'm so excited. I guess I'm excited to want to talk about it.
And explain a little bit. People may not know what OBOT is, Holly.
So that's the addiction medicine, women that are struggling with substance use and addiction. But to be able to bring midwives into that program, and to be able to bring a sense of normalcy and holistic into that program is so exciting, because as Becca was saying, just to be able to help bring whole picture and holistic and normal into everything that we touch is just awesome.
Exactly. I mean, that is really exciting. That I'm a neuroscientist, and I study addiction and kind of health behaviors in addiction and obesity. And if you're coming into your pregnancy with a whole variety of issues, right, it would be so nice to go into the whole experience, the journey of pregnancy and the postpartum period, learning about these health behaviors, using it as an opportunity to just feel better, make better health decisions that can then last you throughout. So that is really exciting. Now, in terms of spaces, I mean, I hear that you're saying the midwives, you can have a midwife and have a hospital birth. What about some other locations and spaces, home births, water births? What are some other options? What are moms doing out there?
You're right. There's a wide continuum where oftentimes midwives are found, which is great, because then it's an opportunity for us to be present wherever women are present. So, and I know Karen Winstead, who was going to be with us today, and I think just to sort of, she has a freestanding birth center in the area. And so, with that, there's a sense of, that's oftentimes now considered to be part of a community birth setting. So that could be home, that could be freestanding birth center. And then those midwives.
Did Becca pause a little bit?
Can you hear me now, Holly?
I can hear you now.
Yes.
Becca's frozen, and
Rebecca is frozen. Okay, great. So we'll just wait for her to come back online.
Okay.
And join us. Yeah, because I figured she was gonna pop off and pop back.
Okay.
So what are your experiences? Have you been in the hospital? Have you been in home births? Other experiences?
My experiences have been hospital only. I haven't done any out of hospital birth. I would like to at some point in my career. But no, at this point in my career, I've been hospital only.
Awesome. So now when you guys keep talking about this education piece, and I know because I'm starting to get into some pregnancy related studies and realizing, wow, there's so much to learn about this stuff. And I know it from a neuroscience perspective, but from that health and wellness piece, from all the different changes that happen physically, emotionally throughout the whole process and into the postpartum period. So what kind of educational resources or information do you offer moms during their pregnancy? What does that look like? Hi, Rebecca. Welcome back.
So, Becca, we're talking about what type of educational resources we offer our moms during pregnancy. We, as far as my group, we don't do a lot of formalized education. We do a lot of individualized education at their prenatal visits. And then we refer out to some community childbirth education through like New River Valley Doula Collective, the Roanoke Doula Collective. I am a huge fan of utilizing the resources that are already available and not reinventing the wheel. Yeah, you guys do a great job. But we do a lot of individualized, and I'm also a huge fan of meeting people where they're at. So I do a lot of individualized education in prenatal visits.
Great. Yeah, so true. So true in terms of wanting to present the information that's needed for that particular family and individual and unit. Absolutely. So for us, we do this, we have a just by gestational age, sort of like a large sort of broad sort of introductory to the practice, and then by gestational age introducing things that seem relevant. And then also we talk a lot about there's a lot of resources out there that are electronic, and so apps and websites and things and chat rooms and things like that. And so we try and also help navigate where safe spaces are in terms of reliable sources. Like it can be a very scary place, it can feel very overwhelming, there's a lot of different opinions, and so we try and do some curation of that for women, like Holly was saying, like what is it that you need right now? So that's a big part of it. We also love the feedback that we get from a lot of our mothers and families that are like, I have this great resource that I think you need to share with everybody. So we're oftentimes like a gathering place for that, for people to be able to bring information, that wisdom, again, that community wisdom, going back to our foundations of where we came from as a profession. And so taking that also and making sure.
Well, and sometimes people are even almost embarrassed to tell me that they've Googled something. And I hate that. I hate that people are embarrassed to tell me that they Google. I love it.
We are that and take the people who might be.
I'm sorry, I think I interrupted Becca because she was cutting out. But I love it when my patients come and tell me that they've Googled something, because there might be a resource that I don't know about and I want to hear about it, because then I can give it to somebody else.
Yeah.
So if you find something awesome, bring it to me.
Yeah, I think that, it's an interesting space to be in an academic or educational standpoint, because the internet does offer all of these things and it's wonderful, and there's Reddit feeds and all this, but then a lot of the information is not so good at the same time. So as a scientist, I'm always going to the direct resources, or even like if I find a hint on a blog, then I'll always go and find the original article, right? The scientific article, which is so important So that's amazing for you to have that knowledge. And then, of course, moms out there are just Googling everything, which is, it's natural. We're curious, and then the resources are out there. But then to have somebody say, okay, well, to validate, okay, this is good, this is not good, and filter that information in a regulated way. So that's awesome. So I know, we don't have too much more time left. So I just want to make sure, is there anything as midwives that you think is important information for moms to know, or something that we haven't touched on that we should talk about?
I think that we've touched on a lot in terms of a lot of the foundations of where we come from as a profession and how we practice in the current contemporary setting. I think that oftentimes, in other parts of the country, midwives are much more, we're still little rare birds down here sometimes. And so people don't always know who we are or where we practice or what type of midwife is practicing where. And there is still a lot of questions. So I always think that if there's anything, if you think, oh, gee, I don't know if I fit in this model, or is this the right thing for me? We always want you to touch base with us, call us, reach out to us.
Absolutely.
We can talk, we can answer questions, we can, be a resource to you. And just with, and if we can't help you, then oftentimes we do have connections in the community, like Holly was saying as well, that we can send you into a direction that might be a good fit for you. So we're here, we want to be here for as many women and families who would like to be a part of, to invite us into their lives. We're always honored to be a part of it.
Exactly.
Yeah, that's something language that I've heard from the doulas and also the lactation consultants. You guys seem so passionate about your profession, which is, sometimes rare, I think, right? That you actually really want to help moms and be a part of their team, and you're really enthusiastic. And why wouldn't moms want to have that kind of person on their side? Because it can be so stressful, and there could be pain, there could be pre-existing conditions, there could be a whole variety of things, not to mention the emotional and strains that come on board, and depending on your family situation and all of that. So so this is an amazing resource that you guys offer, and we thank you so much for your time. And I don't know if there's any more questions from the audience or anything else. Okay, if you had any questions, I'll give just a moment and then I'll conclude. So I think
and thinking and just thinking about resources, thank you. Like, it's super exciting to have Hum part of our community now, like the Huddle Up Moms. What a great place to be able to send women for curated resources that feel safe and good and healthy.
Definitely, yeah. And
then to put this together in the middle of a pandemic.
Thank you. It's really so sweet and special of you to say that. Yeah, it's it's one of these things you're starting and you don't kind of know what it's going to emerge into, but now I'm starting to do research on some of these pregnancy studies and bring these health resources to the community, and it's so exciting because I'm like, oh, I'm thinking about having a third. I'm like, oh my gosh, well, this will be so exciting because then I have all these resources, and it's really neat to see that you can put kind of a whole team of people together to really support you in all of the different needs, the breastfeeding, the mental health piece, the pain. I have chronic pain and, all these things. So it's like, oh, this is fantastic. So, yeah. So that's about it. This concludes the question and answer session for today. And we appreciate all of our panelists for taking the time to speak with us. And thank you, Katie, for joining us in this discussion. This will be available online. We've recorded this session, and we'd just like to thank our summit sponsors, Dr. John Harding and Star Lactation, for your support in our research summit and supporting moms in the Roanoke Valley. And we hope that you all are able to continue participating in the other sessions offered today. And these resources are going to be available recorded and online. So we thank you again, and hope to see you soon. Bye.